Bismillahirrahmanirrahim. Good morning, everyone. Today I will be presenting a case study on a severe instance of postpartum metritis. History: our patient was a 4-year-old boy who had recently birthed to 4 kids. 3 were healthy and 1 was stillborn. Her presentation was concerning that she showed lethargy, anorexia, decreased milk production, and recumbency. She showed initially treated for suspected metritis, but her condition continued to decline over 5 days. Then it was referred for more intensive evaluation. Clinical findings: upon physical examination, the boy was tachypneic and hypothermic. Auscultation revealed abnormal sounds in the chest cavity. Lab work painted a picture of systemic collapse. A blood gas analysis indicated severe metabolic acidosis and electrolyte imbalance. Furthermore, a complete blood count showed significant neutropenia and hyperglycemia, all strongly suggested a severe systemic infectious process. Now, postpartum findings. On closure postpartum examination, we observed severe subcutaneous edema and found significant pathology in the reproductive tract, peritoneal fluid, and extensive necrosis in the uterus, accompanied by multiple petechiae and a malodorous discharge. The gross pathology you see in the image clearly illustrates the severity of the uterine infection. Now, differential diagnosis. The initial clinical picture with evidence of systemic issue lead our differential diagnosis to include life-threatening conditions like sepsis, multiple ovarian dysfunction syndrome, MODS, and systemic inflammatory response syndrome, SIRS. Now we will move toward the histopathological analysis. The histopathological analysis provides crucial information. Analysis show coagulative necrosis and presence of both positive gram bacteria and negative gram bacteria. It confirms the severe infection because both positive and negative gram bacteria are involved. The specific morphological diagnoses are acute necrosuppurative metritis with the presence of P. Clostridium sordillae, indicating a severe Clostridium infection. Now we will move toward the diagnosis. Based on all the findings, the final diagnosis was postpartum clostridial metritis, which was caused specifically by the Clostridium sordillae. This primary infection was complicated by secondary septicemia involving other opportunistic bacteria, namely as E. coli. This mixed rapidly progressive infection accounts for the boy's rapid decline in the body condition. Now we will move toward the treatment and prevention plan. Treatment focused on a multi-approach. This include aggressive systemic antibiotics such as penicillin, clindamycin, and tetracyclines to target mixed bacterial populations, particularly the clostridial component. We also administer the tetanus prophylaxis and provide extensive supportive therapy to correct the systemic imbalances and combat or to remove the shock. In terms of future prevention, we have 2 strategies, and these 2 strategies are recommended. Number 1, promoting the uterine evacuation using oxytocin or prostaglandin to help clear any residual infection or necrotic tissue. Number 2, ensuring proper selenium and mineral supplementation during gestation, as deficiencies can predispose animal to retain fetal membrane and subsequent uterine infections. So this case discussed the role of retained placental membranes and stress as predisposing factors for postpartum metritis in goats. Clostridium sordillae is highly notable pathogen responsible for severe postpartum infection previously unreported in the goats. So this was about today's case study. Thanking you all for your precious time.